Hello, and welcome to our Care Partner Town Hall today. I'm Kim Nitz, a Community Program Manager from the Heartland chapter of the Parkinsons Foundation. I'm tuning in today from the Kansas City area, and we warmly welcome our participants from around the country. I would welcome you all to put a note in the chat at the bottom of your screen with where you're joining from today, just so we can see where all of our care partners are from. We hope you continue to join us at our virtual PD Health at Home programs, including Mindfulness Mondays, Wellness Wednesdays, and Fitness Fridays. These are inspired by feedback from all of you, our viewers, so thank you in advance for any feedback you may have, including after today's program. Today's session will be recorded and posted on parkinson.org/pdhealth, where you'll also find all upcoming and past recorded programs for you to view. PD Health at Home is presented by the Light of Day Foundation, whose generosity has made this programming possible. Our thanks to them. So first off today, we want to give a shout out to all of our care partners during National Caregivers Month. Our Parkinsons Foundation Director of Marketing, Julie Kennelly, is here to share some highlights with us. I'll turn it over to you, Julie.
Thanks, Kim. Hi, everybody. My name is Julie, and I'm the Director of Marketing, as Kim said. And I just wanted to quickly thank you guys and introduce what we're doing for National Family Caregiver Month. So every November, we join with organizations around the world to honor care partners for National Family Caregiver Month. This year, more than ever, we need to honor care partners for the work that they're doing in the home. They deserve recognition. So we decided to make this theme Hero at Home. Now, we know that everyone works tirelessly to keep their loved ones safe, and we think that that's so important. So we are planning a large campaign. It has social media, national media, and we're encouraging people to download our sign that you see on the screen here. And if you can click, you'll see how we expect you to write in. You can write in that white space who you are thankful for. And those signs can be placed on your wall, in your window. You can hold it up and post on social media. And we're going to take a photo with these at the end of my slides. So to get started, we'll just go through to the next slide. All right, so as part of our campaign, we really wanted to get caregiver content out there, not just information for care partners so they can better take care of their loved ones, but also just honoring the work that they're doing, because a lot of people don't know the tireless efforts that care partners put in to keep their loved ones safe. So from a national level, the Parkinsons Foundation is really making it our mission this month to honor care partners. On the screen, you can see our Parkinsons Report. This gets mailed out to about 75,000 people, I'm pretty sure. And we've made this entire one care partner themed. So there's the top care partner resources. There's stories about loved ones. There's a spotlight on the hero at home, and a lot of information there that's helpful and honors what you guys do. Next slide. On our website, you can see here we've created a whole page for care partners. This also has the sign that we're really pushing, but it has all of the resources kind of thrown into one place so that you can get information to better take care of your loved ones. So there's the book there, Caring and Coping. That's a very popular one that we have. And then a lot of different options, just different things that you may not know exist or you may not know that you need. But we think that they're important, and so we've put them all on this one page. And the link is being shared in the chat. So if you haven't checked this out yet, I encourage you to do so. You may find something that can help you. Next slide. We also have a fun new game. We worked with AARP to develop this. It's called the Care to Talk cards. You can order these through AARP's website if you want a physical version, but we also have this digital version that we made that's a lot easier. If you can see on the screen, this is how it looks, and then if you click, you can flip over the Care to Talk card, and it has a question that's really important for care partners and their loved ones to talk about. because there are some things that may not seem comfortable to talk about with the person that you're taking care of, and they may not feel comfortable telling care partners what's going on with them. So this just helps spur the conversation, and throughout the month, we encourage you to do a few a day, one a day, just to start talking. It should help build better relationships and get both parties understanding more of what they need. Next slide. We also have a national social media campaign, and we hope that you'll participate in this if you are on social media. From our national level, we've created a lot of materials. Everything that you've seen in the previous slides, we're going to be pushing out on social media. So that's already started, obviously, since we're a little bit through the month of November. You can go on our social media now and scroll back and see these. We'd love for you to share, click, send them to your family and friends. It has a lot of helpful resources, and just getting it to more people. So we can share to you if we connect with you, but if you share to your network, it'll help us reach people that we may not be able to reach on our own. So this is a great way for us to spread much more than we could do on our own. So if you could go check that out, we would really appreciate it. Okay, and then lastly, if you want to click to the next slide. We are going to take a photo after this, but I just wanted to let everyone know from the bottom of our hearts at the communications team and the Parkinson's Foundation that we are so thankful for all that you guys do to help people with Parkinson's and any loved one that needs care. Personally, I have needed care in the last week. I just went through a knee surgery. So I understand now more than ever what you guys do every day to help your loved ones. So thank you from the Parkinson's Foundation. We understand what you guys are going through, and we try to get you the information that you need to make your life better. If there's ever anything that you can think of that we're not providing, please send it my way and we'll make sure we can get that together. So I think now we're going to take the photo. If you don't want to be in the photo, you are welcome to not be. The way that you can kind of alert us to that is to either cover your face, so you could put your finger up on your screen. If you're able to stop your video, that would be a way to do it as well. But we're gonna take this photo now. So if you have your sign, hold it up. You want to get it so that you can see your sign. And now I think Danielle is going to take the picture. Okay, so thank you guys for having me on. We appreciate what you do so much, and there is a lot of great content coming up, so I'm so glad you've joined us. And that's it from me, but I'll be here watching and listening, so if you have questions, you can ask me at the end.
Perfect. Thank you, Julie. And as Julie said, we encourage you to keep the conversation going within the chat. Next, I'd like to introduce our speakers for the day. And we have two members of our Parkinson's Foundation Helpline team with us here today. These specialists support the national Parkinson's community through our 1-800-4PD-INFO helpline, where they help callers in navigating the questions, symptoms, and challenges that you may encounter on the Parkinson's journey. So from our helpline, I'd like to welcome Amanda Janicke, who is a licensed clinical social worker and a certified dementia practitioner, and Anna Hedges, who has a master's of social work and helped to originally establish our Parkinson's Foundation helpline. I will turn it over to Anna and Amanda.
Thank you, Kim. Hi, everybody. We're so glad to be with you today. We're going to kick things off with a poll. So you should be seeing a poll pop up on your screen. The question is, how are you doing with your current self-care? So we'd like you to take a moment to vote. Okay, so you see the results are, looks like about 20% of people say that they feel like they've successfully implemented a self-care routine. About 7% of people say self-care. What is self-care? And the majority, 73% of people with us right now, are saying that they feel like they could do better with practicing self-care. So thank you so much for sharing. Really appreciate you taking the time to complete that poll. And we're going to get started. So, as a caregiver, you have a lot of responsibility, right? You're supporting, you're advocating, caring for your loved one with Parkinson's. And we know you're trying to keep things organized and running smoothly for them as much as possible. The pandemic really introduced new responsibilities and worries. And the holidays in the middle of a pandemic brings an added set of challenges and pressures. I mean, the holidays can be chaotic even when we're not in a pandemic. But with all that going on, it can be easy to put your needs last among all the other to dos. But we're hoping that you, as the care partner, consider taking care of yourself among the top priorities for you. Many of you listening today truly are the oil in the machine, keeping everything running smoothly with your loved one with Parkinson's. So that's why we're here today to think about how, amidst all the challenges presented to us this year and this holiday season, how you as care partners can incorporate much needed self care into your routine. So we know that there are some people listening today who feel like they're doing pretty well with their self-care, but many others feel like they need a little support with making self-care a reality in their lives, or people who may feel like they need to protect their self-care time a little more fiercely than they have been. Let's just say that either way, the fact that you're here today is evidence that you're making time for self-care, and we hope you give yourself credit for that. But before we start looking at self care strategies, we'd like to take a moment to review why self care is important. Why is it worth making time for? And what does it really mean? So, all of us have priorities we need to focus on and values we try to live by each day. For all of you here, we know that supporting your loved one with Parkinson's is a priority. You likely have many other responsibilities in your life that are important to you and require your time and attention as well. Over time, the daily focus on making sure that you tend to all your priorities can wear you down and cause you to burn out or even get sick. And when you get that run down, you're not able to focus as much on your priorities, on your values, and on your loved ones that you care so much about. For you to continue focusing on what's important to you day in, day out requires taking care of yourself. And we know that means taking care of your body, your mind, your soul. The goal is to try to incorporate self care into your routine regularly in hopes that it'll help you stay healthy and prevent burnout. It's about trying to rebalance the give and take. And it may need to be scheduled, put on a timer. It might need to be just 5 minutes a day that you're carving out for self-care. It might need to be planned ahead, but it also may require you to be flexible and really listen to yourself, your thoughts, your body, your heart, about when you need to take some time now to recharge. And it's an ongoing process to work at. It's going to look different from person to person. But being a hero at home, it doesn't mean that you can't take a break or that you don't need to take care of yourself or that you can't get run down. Really, in contrast, in order to continue doing the work of a hero, treating yourself kindly is a must. It's essential to find ways to replenish, refuel, recharge. And research shows that this can actually make a positive impact on the person you're caring for, too. Well, Anna's going to share some ideas with you now about navigating the holidays during this time of COVID-19, keeping self care needs in mind.
Are looking different, so it's time to start some new traditions. First, take some time to acknowledge any sadness, disappointment, or anger you and your loved one might feel. Avoid minimizing emotions. Acknowledge that it's tough. We all have to make our own hard decisions, and I've had to make the very difficult decision not to visit my elderly parents in another state because I would be traveling to Miami, which has one of the, I would be traveling from Miami, which has one of the highest rates of COVID in the nation. And I'm upset about it, and that's okay. If you're having a really hard time, journal about it or set up an appointment with a counselor. Talk to your family also about new traditions you can have during the pandemic if old ones are not feasible. Second, evaluate you and your loved one's risks. According to a recent study by the University of Iowa, people with Parkinson's who have COVID have a 30% greater risk of dying from COVID than the general population that does not have Parkinson's. If you are in a part of the country with high transmission rates, curtailing large gatherings is important. If your loved ones would have to travel to you from a place with high COVID rates, maybe it's time to make the hard decision to ask that they stay home. Maybe you aren't allowed to see your loved one because they are in an assisted living facility or a nursing home, or you can't travel to see them. Many of us have a bubble of a few people we see regularly. You can ask such friends in your bubble if you can join them for a holiday meal if you can't join your family. Or if your loved ones are not in your regular bubble, a quick meetup outside might be nice while social distancing. And for your loved one, you can that's in the facility, you can write cards, send flowers, send sweet treats, and call. According to our medical director, scientists don't think that giving baked goods causes the virus to spread. Maybe your family isn't able to visit and you're feeling down about that, about not having a big family gathering. Try to schedule a Zoom meeting or a Zoom meal with your family. Ask your tech savvy loved ones to help set it up or try FaceTime or any of a number of such apps and that computer programs. Maybe you are having a family gathering. Maybe it isn't realistic to wear a mask or stay 6 feet apart, but to the best of your ability, try. Maybe you can eat outside this year if the weather is good and you have tables. Or if you're eating inside, opening the windows for better ventilation is good. Maybe hug, but don't kiss. Wash your hands frequently. It also might be less stressful to meet for a shorter amount of time than you usually do. This also lowers the risk of transmission. And of course, if someone is feeling sick or you or your loved one is feeling sick, do not gather. We'd also like to take a moment to plug Dr. Oken, our medical director's Facebook Live about COVID and the holidays and highlight his 3Cs rule. Cover your face, control your environment, contain your environment. So cover your face with 2 to 3 ply masks, no neck gaiters or bandanas. Those have not been very effective. Control your environment. Outside visits should be distance apart, and should be better than inside visits. Contain your environment. Gatherings should be less than 10 people and try to eat outside, or if you're eating inside, spread out. Amanda and I are now going to share some more self-care tips to consider this unique holiday season.
Thanks, Anna. The tip we want to suggest first is a very practical one that may reduce stress and headaches down the road. And that is to find out now who on your loved one's medical team you should call if any questions or challenges arise during the holidays, just in case that is a different person or a different number, or their hours have changed because of the holidays.
Tip 2, consider arranging help with your caregiving duties early before we get deeper into the holiday. Try to envision where or when you might be stretched too thin. Arranging help might mean delegating certain things to other family members or trusted friends, or setting up formal in home care support. Of course, weighing the benefits and risks of COVID.
What about setting up extra counseling appointments if you think that you might need a lot of emotional support during the holidays? And if you don't have a counselor yet, but you've been thinking about finding one, let your doctor know or reach out to us on the helpline for some ideas of where to find one.
Prioritize the holiday activities and traditions that mean the most to you, and just do those so you don't get overwhelmed trying to do so much. Give yourself permission to do less. Let's sit with that for a moment. Give yourself permission to do less.
Remember that other people's moods are not your responsibility. If you find yourself getting caught up or brought down by someone else's attitude, try to create some space from that person if possible, or give them a little more grace as everyone is having a harder time during the pandemic. Of course, they're allowed to feel the way they feel, but you're also allowed to set boundaries and ask for what you need.
Practice gratitude. It really may take some practice to look for what around you is going well or to give yourself credit for all you're doing to stay afloat. But continued practice of gratitude can shift our mindset so that our outlook and mood improves over time. Take a few minutes to practice saying kind words to yourself. There may be words you wish your partner or your family would say to you, acknowledging all of that you do for them, but you don't need to wait for that to happen. You know in your heart all you do on a daily basis for your loved ones. So give yourself some credit. Really say to yourself, I give myself credit for, and finish the sentence. This is a way to practice gratitude for you, for the energy you put into caregiving.
What about instead of cooking, try ordering pre made meals from your favorite restaurant or the grocery store, or ask someone else to cook and have family members bring food so that you don't have to do it all. But if you do love to cook, by all means, cook. Remember that self care involves prioritizing what is most important to you.
Do your shopping early online instead of being with the crowds. Or just send cards and explain that you hope they understand that as a caregiver, you're too overwhelmed to shop this year. You'll be surprised that your family will understand.
Okay, what about telling family and friends that rather than a gift this year, you'd like caregiving assistance so you can take some time for yourself? Maybe this means that your family member or friend comes over to lend a helping hand if feasible and safe, or maybe this looks like them engaging your loved one in a call over FaceTime or over the phone just to give you a few minutes to yourself. Or maybe it means giving your family or friends the opportunity to contribute financially towards home care if they can.
Think about what would help you recharge and how to make that a reality. For some care partners, that might mean finding a way to carve out time to just do nothing and to not feel bad about it. For others, it might mean finding a way to set aside time to call with your friend that you have been too busy to connect with lately. Consider whether finding a caregiver support group may offer you an outlet. In other cases, your recharging may need to be time where you don't have to think about or talk about Parkinson's at all. If you've been feeling disconnected to important parts of your identity, try to consider ways to reconnect with those parts.
Spiritually, many of us are struggling this year, especially just given how the pandemic has uprooted our sense of normalcy and routine. So, think about how you can tend to your spiritual self care needs. Maybe that means spending more time outside, observing nature. For other people, this might mean calling your spiritual community, your spiritual leader to ask for more support or prayer. Other people listening may feel that spiritual self care needs means meditating or listening to music that makes you feel alive.
Some people find that relaxing imagery or progressive muscle relaxation techniques can bring feelings of peace and comfort, so that's something to consider trying. Keep in mind also the major benefits of setting aside time for exercise, also. It helps with depression and gives you more energy.
Okay, what about making a list of to dos during the holidays and putting self care on that list? You might even want to make a list of to don'ts and stick to it in order to help you set boundaries.
What about mixing small pleasures throughout your normal daily activities? Something to give you a little boost, like lighting a candle that smells great or making it a point to play your favorite music while you're doing the laundry or cooking. I just bought a cinnamon broom and it's filling up my apartment and smells delicious.
Well, before Anna and I transition to show you some of our favorite caregiving resources from our website, we want to take a moment to acknowledge something. We know that what we've been doing so far today is riddle off tips and suggestions one after the other. And for some of you, this might have been exactly what you needed, but we believe that there may be others listening who are feeling discouraged or like you really can't envision where to fit any of this into your life. I just want to say, please be patient and give yourself some grace, some compassion. It's called practicing self care because it really does take practice. And we shared ideas today that work for some people, but the goal is to consider what might really resonate with you, what might bring you some peace and comfort, and how to make that happen in your life. We also know that some of the self care options we presented require you to really carefully weigh sometimes two competing risks, like the risk of caregiver burnout by not getting help or asking for help or taking a break, versus the risks associated with asking for help or getting help from others presented during the pandemic. And so, if you're not sure how to weigh or navigate those risks, we encourage you to share those concerns with the people and professionals in your life that you trust so that self care can be a priority even in the midst of a pandemic. All right, so we are ready to pull up a PowerPoint presentation for you showing you some of our favorite resources. All right, thank you so much. So our first slide that you're looking at here is the Caregiver Self-Assessment Tool, which is a link that was shared with you when you registered for the program today. And we encourage you to complete that screening tool if you haven't yet. What it does is help you gauge how you're doing with self-care and whether you're at risk for burnout. Next slide, please.
Next, we wanted to share this website from the Centers of Disease Control and Prevention. You can actually select your state and click on your county to find out what the COVID-19 rates are in your county so that you can determine whether or not travel is a safe idea. Next slide.
We want to remind you, of course, that the Parkinson's has a helpline. We're here Monday through Friday from 9 a.m. to 8 p.m. Eastern Time at 1-800-4PD-INFO. That's 1-800-473-4636. We're here with support and resources available in English and Spanish. We're also available by email at helpline@parkinson.org. Next slide, please.
The next slide is our favorite caregiving resources page. It has some great websites that you should all take a look at. Next slide.
Oh, I'm sorry. Can we back up one slide? Sorry about that. Thank you. All right. So what you're looking at here is a list of veteran resources. So if you are watching today and caring for a veteran with Parkinson's, we want you to know that the VA has a VA caregiver support line, and that phone number is 855-260-3274. We also encourage you to check out this list of other veteran affairs resources relevant to people with Parkinson's, which is on our website. Next slide.
Okay, now this is the slide with the caregiving resources we just passed up. All right, next slide.
Okay, what you're looking at here is a reminder that we have a booklet, actually a book called Caring and Coping. That's a free resource that we offer here at the Parkinson's Foundation, and does offer a lot of helpful caregiving worksheets. So if you don't have that book, please give us a call on the helpline or check it out online where you can also order a copy. Next slide.
So check out pdconversations.org. It has a special caregiving forum where you and other caregivers can ask and give each other advice.
All right, so here we are looking at our parkinsons.org/PD Health. So PD Health at Home, that's a program you're joining us through today. We want to remind you about Mindful Mondays in particular, which features meditations and it's definitely a good way to practice self-care as well. Next slide.
You can enjoy My PD Story on our website at this address. Many of the stories are really uplifting, and you can write your own as a journaling exercise. And if you feel like it, you can submit it to be on our website.
Okay, so this last slide here is about a program that AARP has called AARP Community Connections. You can check out your area for formal and informal groups that offer help. Just be careful, these groups are not vetted by the Parkinson's Foundation or AARP, but you may want to check it out and see what they have going on locally.
Yes, I noticed in Miami, most of the groups are affiliated with universities. So it's students and things like that. Of course, make sure that you're safe with COVID.
All right, thank you. So that wraps up our resources section of our presentation. And Melody, I'm going to hand it over to you.
Thank you both. And Amanda and Anna, thank you for sharing your expertise with us and these fantastic resources for our care partners here joining us today. Hello, everyone. I'm Melody McLaughlin. I'm the Community Program Manager for the New England chapter of the Parkinson's Foundation, if you couldn't tell by my sign behind me. We would love to see who is joining us today. So if you haven't already and you're able to, please turn on your video by clicking on the Start Video button on the bottom black banner of your screen. I imagine some of you might have questions or maybe some comments about your own experiences with self-care, and we'd love to take some time to address those now. Just a housekeeping note to reduce background noise and echo. We just ask that anyone who would like to ask a question or maybe make a comment, please raise your hand. I will look for you and you can unmute yourself when I call on you. And without further ado, does anyone have any questions about self-care for our helpline staff? Or maybe you wish to share one of your favorite self-care tips? I'll be looking for those hands. I thank you all for your excellent questions and for sharing these special tips with us today. I know they'll take us through the holidays and into the new year. You know, as I said, as caregivers, you truly are the experts, and I, for one, have appreciated your expert insights. And another thanks, of course, to Amanda and Anna and Julie for this great town hall and joining us today. I will kick it back to Kim for closing remarks.
Sorry, I was on mute there. Yes, thank you to everyone. We do want to encourage you. We have a week off next week, but we want to encourage you to join us on Wednesday, December 2nd. We have a great program coming up, very relevant to our care partners, psychologists, social workers, and counselors, and how can they help. So you can register again at parkinson.org/pdhealth. We hope in the meantime you have a safe Thanksgiving at home. We hope to see you all soon, and please stay well. And this wraps up our program for today.